Hello, my name is Jacob Selby, and I am a student in PSY 459 for the fall of 2020. Today I will be presenting the mental illness that I chose to investigate, which is schizophrenia. So, to begin with, what is schizophrenia? Schizophrenia is a severe mental illness which can affect a person's cognition, thinking patterns, behavior, and daily life. People who suffer from schizophrenia may feel as if they have lost touch with reality, and people who suffer from schizophrenia can enter a state of being known as psychosis. And as we will see, psychosis is a state of being where people have felt as if they have lost touch with reality, or cannot even tell. So, to begin with, what is psychosis? Well, psychosis is a condition which affects the brain's ability to effectively and accurately process incoming information. People who suffer from psychosis may lose touch with reality and experience phenomena which are not actually present. And as we'll see, this can manifest itself in several different ways. And psychosis is actually a symptom of certain types of mental illness and not a mental illness in itself. So when we're talking about psychosis in terms of schizophrenia, we're not actually talking about a different mental illness, just a component of schizophrenia. So this is the diagnosis criteria for schizophrenia as designated by the current DSM-5. And as you can see, I have 5 different criteria listed here. And in order for diagnosis to occur, we're typically looking for 2 or more of those to happen within a 1-month period. So the first thing is delusions, which are false beliefs that are not based in reality. An example of this could be conspiracy theories or something like that people tend to hold on to for long periods of time. Or hallucinations. This could be seeing or hearing something that isn't existing there. Common with many types of pharmaceutical drug use, like LSD. Then disorganized speech is also quite common with schizophrenia. This is like not using coherent arguments or meanings, so like rambling or talking about things that don't make sense. And disorganized motor behavior is also quite common with schizophrenia. This is moving around in a very strange way, like a child, or a very juvenile sort of way. And negative life outcomes are also quite common with schizophrenia. These are like not being able to hold a job, maintaining housing, going to prison, this sort of thing. So the age that schizophrenia presents itself is typically in the early 20s for men and late 20s for women. Diagnosis can occur anywhere from the teenage years up into adulthood. It is quite rare for a diagnosis of schizophrenia to occur in childhood years, and we'll see more about why that is later. And it also doesn't tend to happen after middle adulthood. You won't see schizophrenia diagnosis happening in the 40s or 50s or anything like that. It tends to mostly just affect the adult populations in their 20s and early 30s. Okay, so this is a graphic that I pulled that shows different ages of diagnosis with schizophrenia. As you see, there's a peak in the 20s for schizophrenia diagnosis, falling off pretty sharply in the late 20s and going back up. As you can see, women tend to go back up at the later 20s again. That's quite common for women to be diagnosed in the later 20s, from what I found in my investigation. And men will tend to have their higher diagnosis earlier. And diagnosis falls off quite rapidly after that in later adulthood. So we're not seeing anything in early childhood, we're not seeing anything in later adulthood, really, or not a lot less in later adulthood as far as diagnosis is concerned. So some of the symptoms leading to diagnosis that we tend to see in the teenage years are withdrawal from friends, poor performance in school, insomnia, depressed mood, irritability, and lack of motivation. These are all quite common in schizophrenic teenagers, and these also tend to overlap a lot with what teenagers are going through normally at this time. So schizophrenia diagnosis can be quite hard in the teenage years. Teenagers who are diagnosed with schizophrenia are also quite a bit more likely to have visual hallucinations as opposed to adults who tend to have a lot more delusional thinking, like we talked about, the conspiracy sort of thinking patterns. So some of the other common things we see in schizophrenia is a lack of awareness. People that have schizophrenia tend to not realize that they have schizophrenia. Their delusional thinking, they aren't realizing that that's a delusion. It seems real to them. So it often requires intervention from family or someone else to help those people get attention. And it is quite important to get attention if they are suffering from schizophrenia, because suicidal ideation is also quite common with schizophrenic people. It is very important for them to get medical intervention sooner rather than later. So some of the cognitive symptoms we tend to see with schizophrenia are that people have difficulties with memory recall, attention, and focusing or concentration. These can interfere with the patient's ability to live a normal life and interact with people to make important decisions. Some of these problems include retaining newly learned information, like learning and actually holding on to information for an extended time. A reduced ability to focus. This could be like just having difficulty actually understanding or following along with things that are going on, and a difficulty using new or novel information to make decisions, like learning something new and using that new information to make decisions. Schizophrenic people tend to have a difficult time doing that. So as a result of these cognitive symptoms, there are negative life outcomes, unfortunately, associated with schizophrenia in quite high amounts. So we'll get into some of the causes of schizophrenia that are believed to be the causes at this point. So it's pretty fairly well accepted now that there's a genetic predisposition for schizophrenia. Schizophrenia is thought to be strongly related to genetics and having a genetic predisposition through family lineage. Some family studies have suggested that there is a strong predisposition to schizophrenia and a higher likelihood of the disorder in patients with a family history of schizophrenia. There does appear to be many genes responsible for schizophrenia. They're still working on gene sequencing and understanding specifically the genes causing schizophrenia, but at this time, that's still a little ways off in the future for genetic modeling to isolate the exact complement of genes that we're seeing which create the symptoms of schizophrenia. So environmental causes, they tend to exacerbate the genetic predisposition of schizophrenia. Schizophrenic people can be affected negatively by environmental causes, which make it more likely for the symptoms to be present. This could be poverty, stress, and malnutrition. Many things like that are very stressful events can all increase the likelihood of schizophrenic symptoms presenting. So it's important for schizophrenic people or people that may be predisposed to schizophrenia to avoid those sorts of stressful activities. So some of the neurological causes of schizophrenia are dysfunction of neurotransmitters in the brain. They can play a key role in schizophrenic episodes. Dopamine in particular has been cited as a neurotransmitter, which is altered in schizophrenic people. Disorders with dopamine receptors. Different patterns of neural networking is also observed. So there are different amounts of volumes in certain regions of the brain than you would see in a typical scan for neural imaging. In fact, there can be up to 25% less gray matter in temporal and frontal lobes, and we'll see that soon. And changes occurring in the brain at puberty may help to trigger schizophrenia at the end of adolescence, as that neuroplasticity and changes in the brain occur in those later teenage years. That's when we start to see some of the onset of schizophrenia, and that also could be part of the reason why we don't see schizophrenia earlier in childhood. So this is from one of the papers that I found. This is just some neural imaging showing gray and white matter of the brain in schizophrenic versus non-schizophrenic people, and also more of these images from the brain showing these differences as well. So some of the treatments for schizophrenia are the use of antipsychotic drugs. These can reduce the frequency and severity of psychotic episodes, and they are the primary treatment for schizophrenia. Unfortunately, they do have some side effects like weight gain, drowsiness, and other cognitive declines. So many people that have schizophrenia tend to refuse to take their medication, and it's not uncommon to see them relapse into psychosis. Oh, and let's see, some of the psychological treatments are cognitive psychological treatments, therapy, and intervention. These can all help people with schizophrenia to cope with and accept their illness, and just to like learn how to deal with having schizophrenia and live a more normal life, address some of the outside stressors that they may have, and cope with their symptoms, to just have more of an acceptance of themselves and to realize their limitations in life. And family counseling can also help schizophrenic people to come to terms with their family and make plans for living a more normal life. So these are some of my sources that I found. These were just some sources from the NIMH and Colorado State. So, all right, thank you very much, and I will see you all next week. Hope you have a great weekend.